Live from the KHOU11 studios, it's Great Day Houston. And now, here's your host, Deborah Duncan.
We're also making health headlines. The discovery of a new body part. And it could mean a lot less pain for some who suffer from knee injuries. Let's find out more in today's Hot Topics. And on our panel today, please welcome cardiologist Dr. Coda Reddy, hormone specialist Dr. Stephen Hotze, and orthopedic surgeon Dr. Wayne Alani. Good morning.
Good morning.
All right, before we get to this new body part thing, let me see your best moves. I want to see you dance. I want to see, yep, I'm actually doing it, okay. This new body part thing, I heard about a new body part. I started looking to see, is there something I've been missing all these years? So tell us about this new body part.
Well, it's in the knee, and it's a thickening on the front of your knee. It's called the Anterior Lateral Ligament, but somebody wants to put their name on it, so they're going to say it's a kind of a new body part. But it's been there, but it's just something that's, you know, getting named is what it amounts to. And it's just this portion you saw there. It's a thickening of the front of the knee that helps stabilize your knee. Because the ACL, people hear about ACL injuries. Yeah. This just helps stabilize the ACL.
So is that how it kind of helps deal with pain?
That's right, and it's also a secondary help to the ACL in case you tear it. It helps your knee from becoming so unstable. So you got to address it in surgery if it's loose, is what it amounts to. But we all want our names on something,
yeah,
so it's kind of like a new body part.
The Alani body part or something like that.
Yeah, that's what we're trying to name it. So yeah.
Also making health headlines, a possible FDA ban on trans fats. We know that Mayor Bloomberg in New York City has done things like that, and so we also know what trans fats can do in our body. But how do you feel about an FDA ban? And some people say,
are you telling me trans fats are bad now?
Oh, yeah, they probably figured out the trans fats are bad. Well, some people say, look, you can ban everything in the world, but people need to take their own personal responsibility. Or others say, but the government sometimes has to look out for the whole and do things like this. So how do you all feel about this?
Basically, ever since trans fats came out, people knew that they were bad. Why? Fungus and bacteria can't break it down. It is the only man-made product which cannot be broken down by bacteria. If you have a burger made with trans fats, it's good 14 years later, you could still eat it. That means what? If it's good, if it's bad for the bacteria, it's deadly for us.
Yeah.
And it's been clearly shown that if you consume trans fats, your cholesterol levels go up, your good cholesterol drops, your bad cholesterol goes up, and you're at very high risk for strokes and heart attacks. So should anybody consume anything with trans fats? The answer is no. So now you're saying that it was grass that is generally regarded as safe. Now it's no more grass. It's dry grass.
Yeah, so it's no longer, so you think the FDA should put the ban on it?
Yes.
Yeah, absolutely?
Absolutely.
I agree, yeah.
Okay. Another study came out, said testosterone replacement therapy can carry health risk with it. We've heard a lot about hormone replacement therapy and then the debate between whether it's really good for you or not. And Dr. Hotze, one of your things that you want to make clear is that there's a difference between synthetic and bioidentical.
That's exactly right. And in this study, apparently it was bioidentical hormones that were used. But we went back and looked at the study, one of our physicians did, and what it showed is that, as a matter of fact, the people that didn't take testosterone, death of all causes, 9.1% of those people had death in 27 months. Those that took testosterone had 5.5%. Heart attacks were increased in those who didn't take testosterone. And also in strokes were increased. So the statistics that were in the paper and the study showed just the opposite of the results they reported. So, and there's loads of studies on the effectiveness and the benefits that testosterone provide, both in preventing heart disease and helping with mental function and cardio, and also libido and romantic moods and inclinations and abilities.
That's what you call it, romantic moods and inclinations. All right. And when we say testosterone, we oftentimes associate that only with men, but women have testosterone also?
Yes, they do. Women make a little, interestingly enough, they make their highest level of testosterone on the day they ovulate. And
so the romantic inclination.
They have romantic inclinations the day they ovulate.
Yes.
I agree with Dr. Hotze, but one other thing you also have to remember that every male who comes in the office says, I need testosterone, I need testosterone. The question you have to ask is, why does your testosterone level go down? Okay, and how come 90% of people, men walking around, have low testosterone? The commonest cause is stress. Any stress, physical or emotional stress, drops testosterone level. The next question you should ask is, what is causing stress that's causing the testosterone level to go down? 85% of Americans consume what? Caffeine. What does caffeine do? It causes enormous stress, and it also causes adrenal fatigue. So if you do not correct the cause, and just because you have stress and just because you have low testosterone as that cause, if you start replacing testosterone, you're also at risk for a lot of side effects. If you actually look at all the side effects of testosterone, if you don't have sleep apnea, you will have sleep apnea. If you have sleep apnea, it actually makes it worse. It makes the blood thick.
Domino effect.
Yes, it makes the blood thick, puts you at a very high risk for strokes. It puts you at a very high risk for prostate cancer. If you don't have it, you're going to accelerate the chance of having prostate cancer. And every male has a prostate.
Wrong. That is not right. The studies do not show that. There's no evidence of an increased risk of prostate cancer with testosterone in people with hypogonadism. There are tons of studies on that.
No, you're right, hypogonadism. But I'm talking about the different, you're giving, not you, but there are physicians giving testosterone for people who don't need it.
So the point being, if you don't need it, having too much can cause issues with anything. But
one thing with testosterone, no matter what, as we get older, our testosterone levels decline. Inevitably, they all decline. They don't stay elevated. You can look at that. So that's why I'm a strong advocate of testosterone supplementation. Have been. I've been taking this since I was 46. I wouldn't be where I was today if I didn't have testosterone.
But you're only 45, Dr. Hotze.
Well, I look 45.
Yeah, right.
I look 45.
And I think the point he was making is that oftentimes you have, it goes back to doctors knowing what they're doing.
Right.
Because you'll have some doctors go, oh, yeah, I've heard this is good. Hey, take this, take this, take that, without really doing the comprehensive work that I know that you all do in your office to make sure the point you made, what is the problem that you're dealing with? We can't just medicate the problem, but we also have to try to remove
Dr. Reddy makes his point is that it's our nutritional status and the things that we consume play a dramatic role in the effect of how our bodies function. So what he's saying basically is, let food be your medicine, medicine be your food. He's written books about that. So he's very strong, and that can adversely, if you don't eat right, obviously, it's going to adversely affect testosterone and other hormone levels as well.
Yeah, put your body in stress. All right, thank you all very much for that. It is time for our Facebook request for today.